Greetings everyone, I am delighted to welcome you to this video lecture series. My name is Dr. Megha Singh, MPT Cardio Assistant Professor at Rabindranath Tagore University. I am here to make learning tuberculosis enjoyable and accessible. Let's dive in and explore together on this engaging educational voyage. Firstly, let's define tuberculosis. Tuberculosis is an infectious bacterial disease caused by Mycobacterium tuberculosis. It affects the lungs but can impact other organs too. Not everyone infected with TB bacteria becomes sick. TB disease in the lungs or throat can be infectious, but TB in the other part of the body such as kidney, lymph nodes, joints or bone is usually not infectious. As a result, two TB related conditions exist: latent TB infection and TB disease. It is preventable and curable. In certain countries, the BCG vaccine is given to babies or small children to prevent TB. The vaccine provides TB outside of the lungs but not in the lungs. Modes of transmission. Now, we should know what are the modes of the transmission. Tuberculosis is spread through the air when a person with untreated TB disease of the lungs coughs, sneezes, laughs or sings. TB is not spread by shaking someone's hand, food or drinks, bad linens or toilet seats, sharing toothbrush, etc. Now, what are the epidemiology? What is the epidemiology? Tuberculosis is present globally. The bulk of the global burden of new infection and tuberculosis death is borne by developing countries with 6 countries: India, Indonesia, China, Nigeria, Pakistan and South Africa, accounting for 60% of TB death in 2015. Now, what are the types of tuberculosis? There are two types of tuberculosis. First is latent TB infection and another one is TB disease. What is latent TB infection? TB bacteria can live in the body without making you sick. This is called latent TB infection. In most people who breathe in TB bacteria and become infected, the body is able to fight the bacteria to stop them from growing. The other one is TB disease. When TB bacteria are active, multiplying in your body, this is called TB disease. For people whose immune system are weak, especially those with HIV infection, the risk of developing TB is much higher than for people with normal immune systems. Now, moving further, we should discuss the signs and symptoms too. So, a bad cough that lasts for 3 weeks or longer, pain in the chest, coughing up blood or sputum. Other symptoms of TB are as weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. Now, TB symptoms may look different in teens, children and babies. Teen symptoms are similar to those of adults. Children ages 1 to 12 may have weight loss and fever that won't go away. But babies may show some symptoms such as be inactive or move slowly, be very fuzzy, throw up or have trouble feeding. Now we should move further with the diagnosis. There are some common tests for tuberculosis. First one is tuberculosis skin testing, also known as Montauk's tuberculin skin test. Second is blood testing. This test is called interferon gamma release assay, IGRA. Third is chest X-ray. It is indicated to rule out or rule in the presence of active TB disease in all screening test positive cases. Next one is fast staining Zeal-Nielsen. Now moving ahead, we should know the treatment. TB is curable with a multi-drug regimen that lasts for at least 6 months. Directly observed therapy, that is known as DOT, ensures adherence to treatment. However, the rise of drug-resistant TB poses a significant challenge to effective treatment. It can be treated with antibiotics. Treatment is recommended for both TB infection and TB disease. The most common used antibiotics are isoniazid, rifampin, pyrazinamide, ethambutol, streptomycin. Whereas, if we talk about some particular medicines for latent and active TB, for this latent tuberculosis, a regime of 3 months of once weekly isoniazid plus Rifampicin is a preferred regimen that is strongly recommended for children aged more than 2 years and adults. Another option is 4 months of daily rifampicin for HIV negative adults and children of all ages. Regimes of 6 or 9 months of daily isoniazid are alternative recommended regimes. And for the treatment of active TB infection, combination therapy is always indicated. Monotherapy should never be used for tuberculosis, such as first-line medication group 1, isoniazid, rifampicin, rifabutin, rifampicin, pyrazinamide, ethambutol. Now moving forward, second line anti-tuberculosis drug group 2, injectable aminoglycosides, amikacin, injectable polypeptides, capreomycin. Now at the end, I would conclude my lecture by telling something about TB in the era of the COVID-19. The COVID-19 pandemic has disrupted TB services and exacerbated TB diagnosis delays and treatment interruptions. Strengthening health system and ensuring continuity of care are critical in mitigating the impact of COVID-19 on TB control. Thank you.